Here I am with my buddy, my afternoon friend, the far infrared sauna. I showed you this on another video. I get in there every afternoon and I spend about 15 or 20 minutes. Apparently cancer does not like high temperatures, and I get in here and raise my temperature above 104 degrees, which kills cancer in the body. There are several therapies like that that I learned about at the Immunity Therapy Center in Tijuana, founded by Carlos Bautista, and that was a place where I was essentially cured. At least it's in abeyance. I'm still working on keeping it there, but I view myself as on the mend from prostate cancer. I found out at the end of February in this year, 2020, that well, I didn't find out anything except that I couldn't go to the bathroom. It sounds funny, I guess, to young people for an old man like me to talk about that, but it's no fun to go through. I have always been physically active and kept myself in good shape. So that came as kind of a shocker to me, although I could feel it gradually coming on over the last 10 years, and I heard other men talking about the same problem. So I figured, well, I'm just getting old. Nothing unusual about that. But then the day comes when you can't do anything, and you get really frightened because you realize you could die if this poison keeps building up inside of you. I guess your bladder is going to get to the point where it kicks the urine back into the kidneys, and shortly after that, you're poisoned and you die. And you realize, I mean, it's like a slow kind of suffocation. It's like not being able to breathe, something you have to do in order to live, and you cannot do it. Well, it was about 2 months before I got the diagnosis that I had cancer. Although I went to 2 different clinics, one of which never seemed to be able to book me to see a true doctor, and the other of which had a doctor who seemed to want to test me for doing various kinds of really cool, neat, new surgeries that he enjoyed doing, and they just didn't get around to taking a PSA test to find out that, in fact, I had cancer. It took them 2 months to get to that, and then another month to tell me about the results of the test. And at that point, the cancer had already started to metastasize, and my specialist basically left me for dead. He was going to give me hormones to ease my transition to the grave, make my last years or months a little better. And I found out later that the hormones he wanted to give me probably would have fed the cancer. So I don't know how nice those months would have been, but they probably would have been fewer than otherwise. Thanks, Doc. This whole series, my name is John Harris, by the way, and I'm making this for my website, semperluxmundi.org, always the light of the world. We pursue issues that have impact on our freedom and our spirituality, which are both very much beleaguered in this ailing society. And specifically, this is the last in a series of videos that I've been making about my experiences with cancer and with the medical establishment. This is really this is a problem, I think, with our social, cultural morale. I talk, by the way, I'll plug this one more time. This is my book that I wrote and published through Amazon, Why I'm Not Dead, and you can buy a copy if you wish or not. I'm not making this video to sell the book, though. I really want to share with you in this one last segment my ideas about why our problem medically is not capitalism. When I was at ITF in Tijuana, I heard a lot of, especially young people from the States, who attributed that it's capitalism that's put us here. That's why these doctors, they keep sticking us with expensive drugs, and they put us through expensive tests and expensive treatments, and they're getting a kickback from all of this. And it's all about making money. If our treatment were in the hands of the state, we would be attended by physicians and nurses and such who had a fixed income, and they would be doing what they did just because they cared about people and they wanted to help. Yeah, well, you know, I made a list here of my experiences. Okay, as I just described to you, I had very long waits. I had my typical wait between appointments where it was a month or 5 weeks. I had a very sloppy diagnosis, when I had any diagnosis at all. I had kind of a one-size-fits-all treatment. And number 4 here spins off of that. I was written off quickly as dead. Well, in a way, that's because the treatment for someone who had metastatic cancer was to die. I mean, that's not a treatment, but to give him something to make death a little less noticeable. Thanks. That sounds like socialized medicine to me. All 4 of those things. That's what we have to expect from a very centralized system where you have everybody covered in the same fashion, and they're all going to the doctor, and they have long lines, and they have to wait, and of course everything's so centralized and bureaucratized that there's kind of a one-size-fits-all diagnosis, and the resources are strained and limited. So if your case proves to be exceptional or has to be addressed in some costly manner, and if you're my age, or if you're disabled or something and not socially useful, then you know, you're not supposed to use the phrase death panel, but you can use some euphemism if you prefer. But essentially, the bureaucrats are going to decide that you're just not worth the investment. You're going to be taking out a lot more from the system than you put into it. So you go off and die somewhere, and then make it as painless as possible. ITC itself, the Immunity Therapy Center, I would tell my fellow patients who started in on capitalism, I would point out to them that the only reason Dr. Bautista was running that place was because he was kind of a maverick. It was innovative. It was using techniques that are not mainstream, and in fact you can't even practice them in this country because our doctors feel threatened by them. Patients would be cured or improved and wouldn't be addicted to costly medicines for the rest of their natural life. So of course our doctors don't want them getting that kind of treatment, but Dr. Bautista was able to provide those services because he had kind of a free rein. I had this explained to me somewhat. I didn't understand it entirely. I don't know that much about Mexico's healthcare system, but I can certainly say that it's overtaxed. It's even more socialized than ours, and there are too many people competing for too few resources. So a lot of people just don't get very good. They get the kind of standardized care. You know, this is what we can afford given the number of you that want something. So this is what you get. It's kind of like being put on bread and water for your diet. And patrons of ITC who have the money, usually it's us wealthy gringos, you know, like I'm wealthy. I'm spending my retirement to get my health taken care of because Medicare is not paying for any of this, like my sauna here. But we have the money, at least somewhere, somehow, to go to ITC and get this treatment. And I think the Mexican government is happy enough to see that because they get some tax revenue, and so these little maverick operations can operate under the radar. When centralization fails, you have little startup, innovative undertakings that can thrive, as it were, in the shadows, and that's kind of exciting, and that's I don't want to explode your bubble, but that's the way it is in the real world. People will find a way to be free, to exercise their choice, to be innovative. When the one-size-fits-all formula just ain't working, eventually people are going to find a way to be free, to break out of their prison. So I'm glad we don't have socialized medicine around the world, or I wouldn't have had ITC as an option. But we're already so close to it in this country. Why do we talk about, no, you don't want to go to socialized medicine in the United States when we already have basically the same effect? And that poses a question that I wanted to raise, which I have asked myself often. Why is our private sector healthcare so much like socialism? That's weird, isn't it? And I think the answer is because, as in so many other sectors of the economy, and I've talked about this in other videos, the more capitalism ages, the more it starts to resemble socialism. It morphs into something that we can call corporatism. The private sector develops players who get so big and powerful that they can kind of be in cahoots with the government. The two of them pass laws and regulations, and they're always for the good of the people, of course, but they make the cost of doing business so high that smaller competitors just can't stick around. So then the bigger corporations, the bigger groups grow even bigger, and they've formed this unholy alliance behind the scenes with government. And essentially, I think, is that not socialism? Well, a tax lawyer would say it's not. I mean, there are some superficial differences, but if you're a patient trying to get health care, for instance, you don't really notice the difference. These are some of the things as I wind up here, that I am not an insurance specialist. I don't know anything about insurance. This is really my unfortunate experience this year is my first experience of the medical system. So I'm just talking from the point of view of someone who's on the ground here, who's gone through this. And some of you may understand the details much, much better than I do. But some of the factors that are at play in this degradation of our system, okay, big pharma. It appears that the pharmaceutical industry has expensive drugs, and I have no doubt that it does. Sure, it costs a lot of money to research and develop these things, but boy, do they get the money back. The drugs are very costly, and naturally they want to persuade the doctors to prescribe the drugs because that helps them make a profit. And I gather that the doctors also get some kind of cut when they do prescribe the drugs. So, and the FDA is in here. You want to think the FDA is non-political? Go ahead. You're welcome to that illusion. But the FDA is approving things that, isn't it funny that stuff like Zantac is involved in massive lawsuits now? Wasn't that FDA approved, and now it's coming to the surface that Zantac causes prostate cancer? What's the good of having an FDA? But anyway, it's all one big happy family there. They're all working together to squeeze money out of the consumer. A lot of doctors, a lot of good doctors, and there are good doctors, don't get me wrong, but I think they're becoming fewer and fewer. The government is imposing more rules and regulations. I've known one or two personally who've gotten out of the profession because it's becoming so top-heavy with red tape. And it's creating fewer doctors to serve more patients. Of course, as Medicare and other programs get bigger and bigger, more people are availing themselves of the chance to go in to see the doctor. And so the waiting list gets longer and longer. Appointments are farther and farther apart. My PSA test, which I didn't hear about for 3 weeks, was supposed to take 7 to 10 days. Well, in Tijuana it took 24 to 48 hours. Even the 7 to 10 days thing is a crock, because what that means is that the line is so long that the labs can't get around to doing your test for quite a while. That's our country. That's what we're going through now, because the system is just so crammed full of patients. Too many people competing for a service with too few providers. This all creates a kind of assembly line treatment as well, because we talked about certain meds and procedures are more expensive, and there's less time to address unusual cases as well. So there's the carrot and the stick there. The doctors want to prescribe the more expensive stuff because they make more money off of it. So do the manufacturers, the pharmaceutical companies, et cetera, et cetera. And there's also just, there's less time to look into unusual cases. Mine was rather unusual in that I hadn't been to a doctor for 30 years. So I think, just assumed that, well, your prostate must be fine. You didn't have any red alert last year, did you? Well, I didn't go to a damn doctor last year, so they didn't quite know what to make of my condition. I wasn't exactly like everybody else, so I didn't show up on their radar. You had both of those things working to create an environment, I think, the profit motive and also, well, we just don't have time motive leads to people being pigeonholed. It leads to the patient being stereotyped. And one last thing that I thought of here, I wrote, private industry likes government's power to force people to be consumers. Again, this isn't just the medical industry. It's characteristic of all corporatism. Big corporations love for government to force people to buy their service. Don't you know that, I'm not going to drop any names here, but say a person who was to develop a vaccine for coronavirus would love for the government to force us all by legislative fiat to go out and get that vaccine. Boy, that would be a gold mine, wouldn't it? This doesn't produce responsible, humane health care. There's too much power and too much money circulating here. It's too much like socialism, brothers and sisters, and eventually it becomes indistinguishable from socialism. This argument is not it's not a clear-cut argument. America's over here, Canada or somebody else is over here. We're capitalists, they're socialists. Believe me, I just got back from Tijuana a couple of months ago. ITC is more free enterprise. That's why it exists. That's a product of freedom. What we have in this country is a product of big brother, unholy, private public sector collaboration and corporatism. And I'm lucky to be alive.